Hey guys, okay, we've been talking about the before and after picture all morning. We have to say good morning to Dr. Bernstein. Good morning.
Good morning.
Good morning to Natasha, our patient. Good morning to Jess. All right, so before we talk about what you have in your hand,
Yes.
You've seen this image of Chelsea Handler, the before and after. You say this is what they call an ablative laser. What does that mean to like regular people?
To regular people, it means there's a little more downtime. It kind of strips away a little bit of the skin. I use those type of lasers when there's a little more photo damage. I don't use them for acne scarring because I don't think they work as well as the non-ablative lasers.
And real quick, you saw a little bit of the blood coming up on her skin. So you say, when you say like downtime, peeling of the skin a little bit?
Yep, and a little bit of like, you can have some crusting and redness from those types of lasers.
Okay.
From the non-ablative lasers, you don't get really downtime.
So non-ablative is just as strong, but you don't get the peeling and the crusty stuff afterwards?
Yeah.
Okay.
You just get kind of pink like Natasha's
Okay,
getting
so
here.
show us what you're doing here. And so this kind of laser you prefer for what type of skin?
For mildly photo damaged skin or for any kind of acne scarring.
And there's a reason why you like these more than the other ones. You said people of color.
Yeah, so you can treat all skin types, which you cannot do with other lasers.
Okay.
That are even many of the non-ablative ones. And you hear that snap?
Yeah.
This is a picosecond domain laser, meaning the pulses are less than a billionth of a second, so you get a different effect on the skin. This is kind of the newest and most exciting type of laser in the fractionated world. And what fractionated means is we're making little dots. We're not treating 100% of the skin. We're treating, 5, 10, 20%. And you can see the little dots as we go. I don't know if you can get this on camera, but
I think you can see it.
It's amazing, actually.
What does she look like in 3 hours?
In 3 hours, she's a little bit pink.
And then what does she look like
about it.
in 3 days?
Nothing. Like this, but better.
And so when
if that's possible.
You saw Chelsea Handler's picture. Obviously, she had a little bit of makeup on. How long do you think time?
I'd say about a week. But it depends what intensity they used. After about a week, you'd be pretty much back to normal.
And you looked at that and you saw some of the wrinkles. So you think wrinkling is probably one of the reasons why they used that
I
laser?
didn't see any wrinkles on her, but what I did see were little dots of kind of blood there. That tells me that was probably an erbium laser as opposed to a CO2. Those are the two main types of ablative laser.
Okay.
And that's because it doesn't leave damage behind. You can see little tiny blood spots.
All right.
That's what gave me the clue.
You look like
a Martian.
Bill Nye the Science Guy,
Yes.
I have to say. And I have to say, thank you for always keeping us safe. As we toss back, why do we have on the glasses?
We have on the glasses because laser light is dangerous to our eyes. And this light's invisible, which makes it even more dangerous because we don't turn away from it. It's not bright.
Okay.
So that's why I teach all the time is laser safety.
All right, laser safety. Again, Chelsea Handler. I'm having what she's having. No, I'm just kidding. I don't know. It just looks really cool, and I'm glad. Thank you for explaining the differences to the civilians, not the doctors. Guys,
Thanks for clearing that up. Yeah. I mean, I might. That's kind of amazing.